when disaster happens, many people start to talk about what is mental health care, what is disability, what is well-being. But we should think about it more and more before disaster to increase our preparedness. So in the disaster situation, everything is confused. So we cannot do what we have not done before. We cannot start a very new thing after disaster. It's ridiculous. So before the disaster, we should imagine more and more what we should do for increase our well-being and encourage our neighbors, colleagues to overcome disabilities. And after disasters, when we think of mental health care, people tend to think about mental health disorders, such as anxiety disorders, depression, or PTSD, and so on. But this is, of course, important, but this occupies only a small part of our whole range of activities. Because most people are resilient, they recover by themselves, creating new ties or community networks by themselves. So the target and goal of their activities should be put in the field of well-being or disabilities. So as I'm a psychiatrist, I always tend to refrain from over-medicalization of the people's response or symptoms. So as a doctor, I think medical activities should be incorporated into a broad range of activity oriented to well-being. The definition of well-being is composed of various factors, and maybe it's similar to the definition of happiness. That we can define the suffering. We can suffer from illness, we can suffer from a shortage of money, and so on and so on. But it's very difficult to define what happiness is for the human being in general. So, and after disaster, so it's also difficult to define the well-being. But from our experience, we have come to notice that there are some important components of that. The first one is actual physical needs when the people have some injury on the body. Of course, the management of the pain or the treatment of the injury should come in the first place. Or there's some life-threatening risks, of course, we should respond due to that risk, of course. But most people are disturbed by the uncertainty about the future. Of course, people can overcome the quake of the land or the shortage of food or water for a short time. But if it lasts for a long time, then it will be a very great burden to them. So adequate information and the future provision will be very important for them. So in other words, we should create a human network and ties. Even if we have only limited resources for us help them, the sense of being attached to the society, attached to the community, or having a sense that other people are caring for them are very, very important. Or remember how you were when you were a child, when you are not with your mother, but when you think you were punished by the mother and the mother has left you, you became very sad. But when the mother said to you, "Oh, I'm sorry, I should go out of our house because of this reason, but we'll come back soon," and so on, the child will be no longer anxious. So in a similar way, in the disaster situation, the victims or people need to have that sense of coherence, sense of attachment to the community. I think this is the most important point. Of course, otherwise there are difficult tasks and issues according to the specificity of each disaster. But what I said now is the most crucial point, I think.